Good afternoon. Welcome to TSPN. I'm Lennox with the American Legion. Today we're going to talk about healthcare a little bit. We don't have all day, so we'll try to capsulize it. But it's on everybody's mind, so it's important, and please stand by, and we'll be right back after this message.
You're watching Amador County's local television network, TSPN.
TSPN. I'm Al Lennox with the American Legion. Today we're going to talk a little bit about healthcare and doctor things. I have with me today Debbie Blasingame. She's the office manager for Dr. Kevin Blasingame. And I have here Christina Martinez. She's a phlebotomist and I didn't get that right the first time, in Dr. Blasingame's office, formerly of Quest.
Yes.
And so today, as you know, the government is shut down, and it's shut down because of health care. Obamacare has created quite a stir, and there's a lot of uncertainty about that right now, and I'm not sure what we can do about it. So let's just chat. Hi, Debbie.
Hi.
Hi, Chris.
Hi.
Okay. Debbie, what do you think? What's some of the problems right now with medical billing, and what do you think? Any inkling on what's going to happen in the future?
No, I don't have my crystal ball.
Right.
The government hasn't decided what they're doing, whether Obamacare is going through or not. Obamacare for doctors and more of your medical facilities, ambulance, and hospitals has been actually going through since 2010. We've been working our way through the different things that we have to do, electronic health records and a bunch of other things that they required doctors and facilities to do before the exchanges and all of the stuff that's going to take place in 2014 for patients.
So it hasn't gotten easier.
No, it hasn't. No, it's become very costly
and burdensome.
Yes, it actually requires a lot more time and attention. Yeah.
In the has it had any effect on your patients at all that you're aware of?
Not on the patients so far, but that will start again in 2014. The exchanges, along with the government shutting down, the thing that actually started today was the ability to enroll in what they call the exchanges,
right,
which is offered by each state for patients who don't have medical care and are also below a certain income level, and you can go on and find a coverage that works for you.
Right. Yeah, there's more opportunity, I guess, out there right now, but the uncertainty of the cost of that opportunity and the availability and what doctors and medical providers are going to accept.
Yes. From what I understand, and I'm not an expert at this by any means, I don't think anybody is, that most of the plans that are offered in the California Exchange are HMOs, which is not something that the doctors in this county accept.
Right.
HMOs tend to pay 40 cents on the dollar, and when doctors and hospitals, well, hospitals have to take it, but doctors take HMOs, basically we make 40 cents on the dollar.
Right.
So if we give away that money, we're making nothing.
Really what it comes down to then and is that the best care in the world isn't any good if you can't access it.
That's right. In order to use an exchange, you'd have to go to Sacramento.
Right.
Yeah,
right.
And that's a long ways for a lot of our people. They're retirement age, and to drive down to Sacramento, every month to see a doctor or a specialist can be quite burdensome.
Do you expect any changes in your office, the way you're doing business, or still too new?
As far as what happens for me, no. It's been going on since 2010. I'll just get less sleep, but because basically we're a small office. Doctor sees the patients and writes up the charts, and I do everything else, and so that just means there's more work.
Oh, sure. The Affordable Health Care Act sure is controversial and discussed quite a bit in your office with your patients.
Yeah. Everybody wants to know how it affects us, and I say exactly what I've told you, and they're quite concerned about how it's going to affect them, and so we do the best we can to hopefully allay those fears. Well, like I said, the government doesn't seem to know what they're doing, so how we're supposed to know what we're to do, we're not really sure.
Sure. The Well, Medicare is the federal program, and Medi-Cal is the state program. Have you heard any changes in either one of those, or are they going to stay?
Medicare, I believe, is going to stay the same. I haven't heard anything from CMS, which is the Centers for Medicare and Medicaid, which is our Medi-Cal program. They haven't said that that's going to change, and most of our patients are Medicare, and then they have a supplement. And from what I understand, that's still going to stay the same. Your Medi-Cal patients or Medicaid patients, I believe, from what I've read, are actually going to be able to enroll in one of those exchanges and get a different kind of coverage. It's been Blue Cross, Blue Shield, a couple of companies that have administered the Medi-Cal program, and I think that that's going to continue. Now, as far as what I understand, Medi-Cal patients, the reimbursement for Medi-Cal patients might be more, but again, it's an HMO program, so who knows what's going to happen.
Right, and we're told that there'll be more people in the market that have insurance.
Yes.
And that may be a good offset to some of the shrinking revenues that healthcare professionals have seen.
Yes.
And we sincerely hope that in the ambulance service, we've seen our revenue go from 45 cents on a dollar to 30 cents on a dollar in the last 5 years.
Oh, yeah.
So this may be a very good thing if it works in fact like it's intended. I think the whole crux of the matter is if the young people sign up like they're supposed to, and that will cover the more expensive care of the seniors, and we'll just have to wait and see on that.
Yeah, that will be the fun part.
Sure.
Because the cost for this is going to be
It's predicated on young people signing up,
yeah.
and so
And in some cases, it's cheaper to take the penalty than it is to sign up.
it is. But you would hope they would not want to assume that risk of
Yes.
not having health care, because it could be catastrophic.
Well, yeah, you don't know exactly what this situation's going to be. I haven't heard if you don't have insurance what the underlying penalty will be. I mean, you have to pay 10% of whatever your income at below the poverty level, but if you show up at a hospital and you don't have insurance, then, what happens then?
Right,
It's
right.
scary.
Sure, and a lot of uncertainty out across the country, and again, we have a shutdown because of it. It's that serious.
Yeah.
Christina,
Yes.
you've recently changed from one place to another, haven't you?
Yes, I have.
And I have to tell you that I've gone to Christina for years for my blood work, etc. I won't use phlebotomist again. I might not say it right. But I've known Christina for, I don't know, 10 years maybe?
Mm-hmm.
Yeah. And you've moved over to Dr. Blasingame's office.
Yes,
How's it going?
I love it. I absolutely have the best of both worlds.
Now, you're independent of the office?
I am independent, yes.
Okay. But that doesn't affect anything you do. You still do your job the same way as...
Just the same as when I was at Quest.
Okay.
I have a courier that comes and picks up all my specimens every day, and the only difference is that we go by appointments because I am alone, and there's a $5 cash copay for when you come in for the blood draws.
Okay. And what's the turnaround on getting results?
Oh, it's 24 to 48 hours.
Oh, that's pretty quick. Because if you need that medication, you need a quick turnaround. How did that happen? How did you go from there to there, or just?
Unfortunately, my husband had hurt his back, and I ended up having to resign from my position at Quest to take care of him for a little while.
Oh.
And over the years, just got to know Doc and Debbie, and
That's Kevin Blasingame. Thank you.
oh yes, thanks. And came into their office and was started to draw their patients, and now opened it up to the public, and
So it's working.
it is working great.
Working good.
Oh, it's wonderful. We saw a need to have someone in our office to help our patients, make more of a whole rounded pie for the patients, make it simple and easy. And Christina was available and is by far the best in the county at drawing blood, and she has a great following, and 90% of our patients went
to her anyway.
Went to her anyway. So as soon as we told them that she was going to be drawing blood out of our office, it's been miraculous. It's been really great.
So it's a good fit.
Oh, it's great. It's great.
Yeah, and I can be a mom now too.
Oh, good. I hope your husband's better.
Yes, he's all better.
Ladies and gentlemen, we're going to take a brief moment and come back and talk a little bit more about health care. Please stand by. And again, you're watching TSPN.
You're watching Amador County's local television network, TSPN.